style transfer.
The clinical education program
I want this to be as safe as possible for her.
is about
Yes, ma'am. You got it. You got it.
being able to provide exposure
Bring it over to the side liar.
to students of all different kinds of clinical disciplines, to working with individuals with intellectual and developmental disabilities, and all the different ways that different disciplines work with individuals to support them in the community.
1, 2, 3. Good.
This is my second level 1 rotation. My level 1 rotations is more so observing, like seeing what's out there, seeing how it operates, providing me with the opportunity to talk with clients and discuss their needs and being able to see like the equipment in action.
Charlotte.
I've enjoyed it a lot.
And we're going to turn it around. Some students come for 2 weeks. Some students come for up to 12 weeks. The benefit of any rotation is hands-on experience, because every therapist needs to learn how to put what they've learned in theory into practice. Here at the Seating and Positioning Clinic, this is a very unique setting, and there is patient handling that is involved, and we are obviously trying to support individuals in DIDD by optimizing their position, making them comfortable, providing for their safety is of utmost concern. So you get to practice all of that.
We have different contracts with various schools across the state in all different regions. And those disciplines can cover anything from occupational therapy, physical therapy, speech, language pathology, dietitians, social work students, LPNs, nursing, and RNs, registered nurses, are a few of the disciplines. Really, it's quite broad, and we're learning from students just as they're learning through us and from the individuals that they work with while they're with us.
You ready, Miss Becky? My coursework states that I have to be at full caseload at my clinicals by week 6. So that basically means that I am taking over my clinical instructor's caseload. So that means I'm doing evaluations, I'm doing MAT assessments, I'm doing specs with vendors, I'm doing all the things. Since this setting is very specialized, I do have to have a lot of help from my CI, but one big thing that I'm doing my clinical project on at this setting is how I can educate therapists that are not in seating and why they should be doing seating. Today we're working on a QOF, which is basically an alternative positioning equipment in order for better sitting for meal times and better positioning in her wheelchair.
Good, that's exactly right.
This experience is helping me to pursue my goals of becoming an ATP one day, as an assistive technology professional.
In the past, we had student affiliations that were set up through the state institutions, which have been gone for some time now. Nationally, state institutions have been in the process of closing and are continuing to close.
Yeah, is that more comfy? Okay.
So that individuals can stay in the community if they were always in the community, or move into the community if they were not in the community. And so they need healthcare services in hospitals and skilled nursing facilities as they age, perhaps, outpatient clinics and other arenas where they seek health care. And so somewhere along the way, students are going to have those interactions. And if we can give them exposure to learning just a few key things, even such as how to communicate with somebody that may not be able to communicate verbally, and learn about things like person-centeredness and to get at what their needs are and what their wants are and what they desire to do in the realm of what we do as clinicians, then they will have a lot of success assisting those individuals.
So we go out and they get experience in completing nutrition assessments with someone with DIDD. Brian can communicate with his eyes. With the enteral nutrition, you can't just write any regimen and think it's going to work. You have to see how the person's day goes. They have different positionings they go in, they go out and do activities. So you have to adjust their enteral nutrition for them, being person-centered. I work with physical therapy. We go out and do heights, like knee height caliber, on some of the people we serve. I work with speech therapy, with the dysphagia and eating. I work with behavior services and with nursing. I mean, we all work together as a team.
I think in every area of life, no matter what somebody's going through, nutrition is key. I'll probably be looking for a clinical job of some sort. That's what's so great about the internship is you get experiences in all different fields, facilities and businesses and so on and so forth.
You know, we're training the next generation of therapists and practitioners.
Even if I don't go in this path, I do think that it is very important that I have had this experience and I can share this information with people that I can encounter. And I think that I've learned so much and it's really made me appreciate what's out there and appreciate this clinic and what they do.
I'm getting a once-in-a-lifetime experience that some of my other colleagues at my school are not getting the privilege of doing. So I'm very thankful for that opportunity.